Welcome to African Voices Platform. My name is Chiwe Chihana. For this very special edition of African Voices Platform, we'll be speaking to the Director for Public Health in Sheffield, Greg Fell. Good evening, Greg Fell, and welcome to African Voices Platform.
Hi, thanks. How are you? Thanks for having me.
No, thank you so much for joining me. Very few questions that we really need clarity around with regard to the Omicron Covid variant that has been identified and obviously announced by Southern African scientists. This has happened within a very short space of time. Flights have been cancelled. We are wondering, there are people who are anxious who would have come within a 7 to 10 day period prior to flights being cancelled that are here in the United Kingdom already. What sort of measures are in place for them to probably be less anxious, for example, and what can they do in order to be checked for this?
So I would say to those that have come back before the government intervention of the weekend, personally, were it me, I would probably isolate for 7 to 10 days. I wouldn't be seeking a PCR test, but I would be doing a lateral flow device test. And actually, people that come back from overseas probably ought to be doing a lateral flow device test. And certainly, if they become unwell, then they should be getting a PCR test. But I would be sort of limiting the contact I have with other people. Definitively, if I become poorly, I'd be absolutely limiting the contact. Should be isolating because that's what the law says. But sort of acting with a little bit more precaution than I might otherwise have been doing. And obviously, if I'm coming back now, then I'm going to have to be in a quarantine hotel for a period and take a PCR test. But I think it's important that we sort of act with a certain degree of vigilance for the next period. And there is if you have come back from Southern Africa, definitely if you feel poorly, get a test and get a test ASAP.
Thank you. What are the modalities around contact tracing around that then for those that would have come in that period? Is there anything different?
So if you take a test and that test is positive, then you become a case. As a human with a positive test. The NHS test and trace system it has been contact tracing all cases and has been for a year and a half now, just about. So nothing much changes, but certainly for cases that where the PCR test is positive and then a genetic sequencing is done. If people have a travel history from overseas, genetic sequencing will be done. And if it turns into an Omicron variant of a case, then the UK Health Security Agency will do the contact tracing, and they'll be doing that with some degree of urgency. And there's a protocol, well-developed protocol for that, which has served us well over the last couple of months, probably about the last 12 months actually.
Right. Okay. Thank you. So the other thing that you mentioned earlier was the mandatory hotel quarantines, which we've experienced before. This is really quite sudden, and there are people who will probably not be able to afford this. And what sort of support systems are there within Sheffield that people can look to for this?
So if you come back from Botswana today, you'll need to book into a mandatory quarantine hotel, and that is paid for. Now I must check this, but I'm fairly sure it's paid for by the government. There are, if you test positive, then there's a range of financial support available to you, and the council administers that system. But we're not. The council is not involved in the mandatory quarantine hotel. In fact, there isn't a quarantine hotel in Sheffield, to my knowledge. There wasn't last time I checked. So, but that stay is not something that the council funds. The government funds that.
Okay, so what I'm more concerned about, I suppose, is you've got people of African heritage who would have gone home and have come back that live here in Sheffield. Is there any sort of support that would be available from the council for the people who live here in Sheffield, that is?
Uh, yeah, so there's a hardship fund and there's the isolation payments, and both are available for any residents of Sheffield from whichever part of town they happen to live with, or whatever heritage they have. I can't remember the number offhand, but I'll make sure I email it to you. And that's very operational. It works. It's been working for quite some time now, and that makes financial support available for people who need it.
Right, thank you. And very lastly, Greg, what we saw with the initial information that was coming out when the virus was first detected was how it stigmatized the Asian population, and a lot of them were victimized socially. We expect with the misinformation that has come out around the identification of this particular variant coming from Southern African laboratories, and that information being made available properly as it should be. Of course, there's some stigma already being attached to people of African heritage, and we're concerned that a similar thing that happened to the Asian population will be happening. What can we trust the council to support us with? What sort of information is there to enable the public to properly accommodate people?
Well, I'll say up front, I mean, I remember the victimization of the Asian community, particularly Chinese community, when this emerged in Wuhan back in early 2020. It's not okay. It was never okay. It happened. Me saying it's not okay doesn't stop it happening. But the reason why we shifted away from the Wuhan flu, and I'm old enough to remember Mexican flu of 10 years ago, we shifted away from calling it by the place name from which this thing emerged to, we currently use Greek alphabet letters for reasons I genuinely don't understand, to disassociate the nature of the variant or the nature of the virus from a certain place. I'm not entirely sure what the council or any one individual agency or stakeholder can do to counter that disinformation. But I will say it's not okay. These things have to emerge somewhere, and my experience tells me always for the initial few days we call it the Botswana strain, which is lazy shorthand. We then give it a whole bunch of complicated letters and numbers, and then we'll give it a Greek name. But it's not okay to be victimizing people of any heritage because a strain of an infectious illness happens to have emerged in a certain part of the world, and that misinformation just needs to be carefully and assiduously called out as and when we come across it. There isn't a magic bullet that any of us have got to fundamentally stop it, but carefully and assiduously calling it out often helps, in my view.
Thank you very much for joining me on African Voices platform.
Welcome back to African Voices. Chiwe, you've just spoken to the Director of Public Health, Sheffield, and in terms of what you've heard, and what's your take on what he has said in terms of the Omicron virus?
So, Bailo, it was really, I was grateful to have the Director of Public Health for Sheffield, Greg Fell, for a very brief moment, but I managed to put in some questions to him, especially, of course, with the concern that this is being labeled very much as a Southern African virus, and there's so many things that have come up within a short space of time. One of the things that he talked about was the mandatory quarantine that everybody's being subjected to that's coming from a red list country, and those are predominantly countries from Southern Africa. And so when I asked him what sort of support people would actually be able to access, given the short notice period where people didn't actually plan and they're already in transit coming here, you have to pay for your quarantine hotel. And I asked him what sort of support would be available for people within Sheffield with council support at all. And he seemed to think that they can access hardship allowance for that. But my experience, if you remember, how long ago was it? I wasn't.
About 2 months ago?
About 3 months ago, when this was still in place, I was in mandatory quarantine, and that option was never given to me. The government does not actually pay for your hotel, so maybe that's information we'd need to check again with the Director of Public Health and where he's getting that from. We pay for that ourselves. So you either, if you're a resident or a citizen of this country, you'd be able to set up a payment plan, for example, where you pay in monthly installments for a 12-month period. But if you're not, as far as I could tell at the time, you would have to meet the cost yourself. So I'm not sure where that information has come from that Greg Phil has provided. Would need to check it.
So in terms of some of the concerns that you had, or some of the concerns that the community will be having, especially someone from Southern Africa, do you think Greg Phil answered some of those concerns that you had? Were there any clarity?
Well, I think when we talked about the victimization of populations based on the labeling of the virus or of the variant so far, he was quite cognizant of the fact that people did get victimized, for example, during the Wuhan whole rhetoric and the language that was being used. So the Asian population was being victimized as a result of it. And he did suggest that, well, confronting those that language or that victimization is probably the best thing that we can actually do. So in terms of proactively creating and providing information to supersede that, to supersede those assumptions by people, that stigmatization and victimization of people of African heritage or those adjacent to African heritage, I think there's nothing that the council has got in place. So there's nothing in Sheffield, for example. It's not seen as an important issue, which I think I would want to disagree with, because I do think that there should be information provided out there, given that this has already been defined. Much as the name has been changed, it has already been defined in the context of Africans, and looking at all the flight bans that have only affected Africans, then at that point you're already stigmatizing and creating a pathway for victimization.
And speaking of that, from my understanding from your interview with him, he said there is nothing that he's aware about a quarantine hotel being available in Sheffield. And as people living in Sheffield or South Yorkshire, as someone who had experienced it yourself as well, being in a quarantine hotel far away in London, do you think it is something that is also needed closer to home?
I think it would be beneficial. I'm not sure where the others are, but I do know that some people were taken to Milton Keynes. I landed at Heathrow, and I was, my flight was redirected to Heathrow. You don't really get to have a say in that. So it was redirected. I was meant to have arrived at Manchester, but I'm assuming it's because there are no quarantine hotels around here. So I went to Heathrow and I was housed in a hotel around the Heathrow area, which of course is the complexity, because once you're done with that mandatory quarantine, you have to make your own way home. Nobody is taking you home. All they can do is take you back to the airport for free using the airport shuttle. But that's not the airport you would have chosen to land at. So it would be good if they could actually make some provision for at least closer locations for those mandatory quarantine hotels. Like I was saying, people are already coming at short notice, being redirected at short notice. They were probably already in transit. For example, Zambians only had about 24 hours notice because they were not in the initial red list. There was about a 24-hour gap between the initial announcement of the red list. So those had time to prepare maybe. And I doubt it really. How much would you really prepare for in 48 hours financially though?
And the fact that, like you said, that was just in 24 hours, short notice, and many people will have been to those areas on holiday. They might have spent all the money that they had, and coming back, I believe there will be financial challenges.
There will definitely be financial challenges. I mean, you're talking in the region of $2,000 and odd. That's quite a big amount of money for anybody. On average, I know there are people who would see that as just a flimsy amount of money, but on average, 2,000 and odd pounds is quite a lot of money for anybody to be meeting at such short notice. And you would have spent your money anyway if you'd been away and you're coming back.
And the fact that also many governments across the world, like the European Union, the UK, and the United States, have now introduced travel ban into Southern Africa. As someone from there originally, do you think that is fair? The fact that even yesterday I heard the president of South Africa saying the travel ban is unjustified and it should be lifted as soon as possible.
President Cyril Ramaphosa, I think I would personally side with what President Cyril Ramaphosa of South Africa said yesterday, because when you look at statistically where this virus has been detected, it's not just in Southern Africa, it's in quite a lot of other countries, and the numbers are even higher in some places. Now, what's very clear is that whilst this virus was detected, scientists in South Africa and Botswana were the first to actually identify the particular genome, as you will, of that variant. And that's what they did. They identified and put the information out there, made it available. And from hence on, the world just decided to stigmatize, but this was already existing in other places. So I think on account of that, everybody should be banned if that's what's going to be happening in that case. But there's actually no tangible reason why it should be just certain countries, and these are Southern African countries that have been given this global ban.
Looking at the fact that also when the coronavirus first started, many countries were blaming China for not being transparent enough, to the world or to the World Health Organization. And now South Africa or Southern Africa has been transparent enough, but now they are paying the price. What do you think other countries will be looking at now if they are transparent? Do you think this might kind of stop or might put other countries in a situation where they will have to think twice when they detect any variant in their countries?
I think that's a very good question to ask, because that's a betrayal of trust. I think that's what's happened. Looking at what has happened as a result of that transparency from South Africa and Botswana, literally you're shutting down whole economies by preventing access to tourism or access to those countries, travel between countries. I wouldn't be surprised if governments that discover some of these things are a bit more skeptical about how they actually announce that they have discovered or identified some of these viruses. And perhaps that's why China was cagey about it. But look, it had devastating consequences. So all in all, I would still say, let's be transparent, let's be visible. But I think the response of the world should be better, because this protects everybody. It doesn't protect one area. It's everybody's interests that are in this.
And how far can you go on this? There are some African analysts or politicians that are saying, it's the usual thing where Africa is always victimized, where Africa is always treated differently, Will you go that far to say this is racism, or this is the double standard where Africa is always, becomes a victim of?
This would very much be my personal opinion. So I'm not speaking on behalf of African Voices platform, but this is me as Chiwe. I would say that we're scapegoated for a lot of things. To start with, we're discriminated against. So I would go as far as saying, yes, this is discriminatory, neo-colonial, and it's a lack of appreciation that we're actually playing on the global stage, probably at even a more experienced level. We have such wide experience in tackling diseases on the continent. Our scientists are savvy, they're experienced. And this time they have come out expressing their prowess at this, and just they're perfect. They're amazing scientists on the continent. They tackle diseases. This is what they do, and then to be treated like this after giving this much information, I do think that there's a very big case of discrimination here. There's a discrepancy.
And what do you think the African Union should now consider here?
It's a very complex one in terms of the African Union and how they come into this, because clearly we have to be concerned, we have to be vigilant about how we're tackling a pandemic. This is a pandemic. The truth is that we are in a pandemic. But I think the African Union should be able to stand its grounds and actually probably equally impose sanctions or limitations on other countries as well from the West, that in equal measure. I appreciate it might be that these are economic decisions that I would have to take a lot into account, but we do also have to make it an even turf, an even playing ground. If you can't have our people, we can't have your people.
And just a final one for me. In terms of support that you asked earlier to Greg Fell, us as Africans here, what would be your advice to the Southern African communities that are living in Sheffield, South Yorkshire, especially the fact that you've been into similar situations?
Okay, so I'm going to say that where possible, go to the government, the UK government website, see what get all the relevant up-to-date information. Obviously, it sounds like the Sheffield City Council website is not up to date, as we were just informed by Greg Fell. He said they're going to be putting out communications, but for now, let's rely on what. The only thing we can do is really rely on what is available to us, and that would be information that's available on the government website. I'm pretty sure that the last time I was coming in, there was a number that you could actually call and probably have a conversation and say, this is not within my reach, and see what can be done about it. But other than that, I think there are also citizens advice bureaus that people can go to. I would recommend that they can phone up whilst in quarantine and say, this is my circumstance, where can I get help and how can I get support? And then in terms of a very localized Sheffield context, Greg Fell said people can look at the hardship allowance. I don't know how that applies in this case, but those are some of the options that are familiar to us, and we'll be putting out more information on the African Voices platforms once we get it.
Well, thank you very much for your time, Kiwe, and to our viewers, thank you very much. This is all we've got time for this evening on this special edition of the Omicron variant. Until next week, this is African Voices platform. Thank you for watching and have a very good night.